Hello, it's Claire O'T and I'm back again and I'm now about to introduce the third of the projects that we're going to talk about today. And this is a project called UsefulApps for service users, and it came out of a conversation about whether or not the Maps and Apps project had picked up on any very good medication tools for management of medication through apps. So we were looking for something which combined doing medication prescription aids for service users so that they knew how much of their medication to take and when, with a reminder that came through on their phone that actually said now is the time to take whichever medication, and which also linked with appointment times and names of different people that you were having appointments with, because each thing that's wrong with you might have a different set of appointments and it can get very confusing to know when you're going where. And apparently we did a bit of a review of the idea scale from the Department of Health Maps and Apps project, and they did look at some medication compliance aids, and there weren't any that reached the MHRC standard. So we would be looking to talk about this project in the context of being a generic application that applied across all the different specialties, all the different types of medication. It would simply unlock the reminders about the dosage and the timings of the dosages, and reminders about appointments and names of people that you're going to see, perhaps a contact number. So we think that this is a really good idea, and we think that the best way to develop this further might be to actually look at doing a pilot with a local health organisation that might be prepared to partner with a group of service users who are developing it. So landing him in it totally, he's Andrew, and he's a governor of a local health trust.
That's right.
So
I think one of the issues that comes up perennially with foundation trusts and secondary care is medicines management. For any trust for whom patient safety is key, and I'd hope there aren't any for whom patient safety isn't key, medicines management is the mainstay. I think although the main driver behind this particular project was to give something, an appropriate app for the service user, and something that would really help somebody with the fundamental task of getting medication right, taking it at the right time, and being able to check back and see that you're taking it, so having some sort of a record. It's going to be difficult to find resources to take something like that forward. It seems sensible that perhaps a project like this might benefit from starting with some sponsorship within the secondary care area, within a trust or within an environment where medicines management is key. There could be some sponsorship from the clinicians and managers within those environments, and the very prospect of trialling the app within a hospital setting would give clear boundaries, clear control, which would be easier to evaluate and to manage through a pilot stage. So I think what we've got to look for are suitably interested sponsors to give us a go on this, and I think we know of a few people in the city region who will be calling on next week to see if they have any interest in trialling this.
yeah, thanks Andrew. I mean that's what this whole experience has been about for us really. It's about connecting the dots locally and seeing what we can actually do to hack the system within our city and within our region so that we can support each other, and by making links between groups of service users, social entrepreneurs, the big secondary care organisations, the voluntary sector, the universities, the researchers there and the students, we can actually affect some of these changes, and we can do it really well actually, and quite quickly, which is really important, because if you're talking about scaling it into the NHS, for instance, that's a big old task. So you've got to have already tried it out to give people the confidence that it's worth trying. And perhaps this is an ideal place to do it, because I do know that the Yorkshire Hayek, one of their work streams is around patient safety, and so perhaps that's another source of funding. So if there's anybody watching from the Hayek system, any of the local commissioners, people who are representing some of the big social care and health organisations, then we're actively looking for support for this project. And if you like it, then make sure that you vote for it. This one is called Useful Apps for Service Users. Okay, so hang on, how about linking into Leeds University computer science students as a hands-on project with stakeholders? Absolutely, Jackie, that was one of the options that we were exploring today. Actually, we had some academics here from the universities, and we were saying that these exploring these ideas would be ideal research projects for people who are studying in those various departments. So yeah, that is absolutely the structure that we're looking at. And yes, John, yeah, we've seen the similarities with Remember the Milk, but I think there might be other things to consider that aren't considered within that app. Because I know that several of the apps that were looked at by the Maps and Apps project, they didn't meet the kind of criteria that they had to come up to be what's it called, medical devices approved, and that's the key thing we think, which those apps don't do, is they don't meet those guidelines. So we have to develop something that's actually meeting those guidelines, which means actually being really explicit with the brief that we present to the developer and saying this is what it has to actually
I think it's worth, I really think, just coming in on that, I think it's worth over-engineering something like this so it meets all the clinical parameters, all the regulatory parameters, and then actually, despite that being a quite huge effort, you'll end up with something that we can use in many different applications, have a broader uptake from service users who are really using it for the most fundamental reasons.
Yeah, absolutely. So it's about, rather than it just being a generic app which is used to remind people about appointments that relate to a particular condition like diabetes, it's something that any service could adopt, whether it's mental health, physical health, and all the rest of it. Yeah, okay. So I'm just going to close down this broadcast now, and we will be broadcasting again in a minute, so stay tuned. It's lovely to have you with us. If you like this one, don't forget to vote for it. Okay, bye.